I'm Alex Richmond. I'm founder and owner of Dermhaus, a new dermatology office in downtown Charleston. I think setting realistic expectations is one of the most important steps in that initial evaluation. Unfortunately, hair is a very slow process. And so when I talk to my patients, I'm telling them it's going to be months, not days or weeks, that we're seeing any improvement. Even though I like to have them come back a few weeks after I see them, it's more so to make sure they're tolerating the medication well. I tell them up front, I'm not going to see any improvement at that time, but I want to make sure the medication is going well. And I also explained that it took a while to get to this amount of hair loss or to get to this stage in the disease. And so it's also going to take that much time, if not longer, to kind of help reverse or help improve the symptoms we're experiencing. And so I think really setting realistic expectations helps with the plan because patients won't give up if they're not seeing improvement a few weeks in. And this is especially important for patients with scarring hair loss because it's really important that they understand the goal isn't to bring back hair where we've lost it because that area is scarred and we won't be able to, but the goal is to keep the hair we have and to really nourish that hair. Yeah, I definitely will do kind of multiple treatments different targeting the hair in different ways to really give it its best chance. And so some of the medications I go to first include minoxidil, finasteride, dutasteride, and even spironolactone. Those help kind of nourish the skin, help nourish the hair. They kind of increase the hair growth cycle. And so those are some of the pills that I typically jump to first. Again, we talk about our side effects, we talk about what's exactly going on, and that kind of helps me decide. But a lot of times I'll start with one of those and then gradually increase and then add a second and sometimes even a third of those pills to really give the hair its best chance. I also will typically add a topical medication, whether it's topical minoxidil or a topical steroid, again, depending on what the type of hair loss it is. And even doing things like low level light therapy at home or PRP will sometimes add. I think patients are now looking into more natural regimens and they don't want to just be adding all these different medications to their treatment plan, which I completely understand. And so I like to also offer other options like PRP or the low level light. I actually love the Extresse supplements. It has very low levels of multiple nutrients that our hair needs and that studies have shown to be effective in hair growth. And what I like about it is the way it's formulated, it's not as likely to cause interactions with other medications that patients are taking. It's very well tolerated and it's a gummy instead of taking multiple pills every morning. So I find my patients really like it and have seen really good results. I'm really excited about the next generation oral minoxidil. Right now, the minoxidil that we use is a heart medication, and it does have kind of a quick spike and downfall. And because of that, we always discuss the risk if you have heart disease or lung disease. And some dermatologists just don't feel comfortable using this medication, even though we're using a very small dose. There's one currently in the end stages of studies, and it's kind of a low gradual increase. And so you don't get that really sharp increase. So I'm super excited to see that. It's more of an extended release. And so it should be a little better tolerated, and the efficacy is just as good.